Hello, everyone. It's Howard from ICN, and I'm delighted to be joined today by Dr. Samaya Al-Blushi, who is the president of the UAE, the United Arab Emirates Nursing Association, and has been attending the Cop28 summit in Dubai. Dr. Samaya, fantastic to have you with us. For those people who have never been to a COP, just give us a sense of what it's like. How is the meeting organized?
Okay, this was the 28th United Nations Climate Change Conference, and it was really an amazing international platform, really to address the need for urgent, unified, transformational actions, as well as the global commitment to mitigate the drastic impacts of climate change in all aspects of human life. Now, the interesting that this time it was the first time ever in the COP that they dedicated a full one day on climate impacts on health. And they discuss a lot of interrelation between the climate change and health. And they explore many things in terms of resilient health system, as well as reducing the cost and carbon emission. So it was a great platform. And to me, it is first time to attend actually COP28. And I wish I would see a lot of nurses, but it was mainly about health, that they were talking about the nurses, doctors, and all health professionals, how they are going to collaborate and work together, starting from themselves. There was a lot of discussions and buy-in from politicians and commitment. And also there was a great announcement and declaration on health done by the president of COP28 declaration on climate and health. And they set off a new finance commitment on climate and health. And there was a commitment that to put, and UAE was the lead of being on that commitment to help or to help the climate change issues specifically. So it was really great, and a lot of sessions have been delivered by many politicians and calling for such resilience in the health system. I attended also the youth forum, which was fantastic, that I was able to chat with UAE nurses who attended this forum and encourage and deliver the ICN messages, as they are part to move forward, protecting life and the future of planet, as supported by ICN. And I strongly advocate for the phase out of fossil fuels. As nursing leader, we are committed to contribute building a resilient health systems and strengthening the health workforce. Also ensuring that part of the climate financing goes to health workforce preparedness for climate action. It was nice to see those youth that they are interested, and it really gave me myself even different perspective on what are the things that we need to consider, even at all level of nursing, as a youth, as a young, as a human, how we can make the environment safe for ourselves and for the coming generations. And these were mainly the topics that I attended, but there were continuously messages that have been delivered within the health day. They focused also on, as I said, the effect of climate on health, the responses to climate change, and how ambitious emission reduction can save lives. Also, finance, a roundtable on climate and health have been occurring to strengthen the role of development also and the financial institutions. There was a good commitment, and first time all the Minister of Health were present in COP28, and they have a great discussions a lot about, as I said, the public-private partnership for health climate actions, and also nexus of health and relief, recovery and peace. And a lot of technology have been discussed, the telemedicine that reduce a lot of carbon emission. Climate and Health Solutions Showcase. There was a lot of showcase event from different countries, and also there was a specific climate and health response in the EMRA region also talk that have been occurring in Cop28.
It's great that you were able to be there and have such a strong voice for nursing and for the health sector. And as you say, historic that there is this focus on health as well. I understand there was a declaration from the health ministers at the end of the health day. Tell us about your impressions about how firm their commitments were and those outcomes that were achieved as a result of the discussions. Can we be optimistic that the health impacts of climate change are going to be dealt with in a much more serious way than they have been up to now?
Well, I saw, yes, a great commitment from all the politicians and a great commitment for such a declaration. And I was personally, I can tell you that really the environment was optimistic, but this means that we need really to move to transformational, collaborative action in order to make sure or to minimize the climate impact on health.
So you've been delivering the ICN messages as well about the importance of fossil fuel phase out, investment in our health systems and the health workforce as well. What are we expecting the next steps to be?
Well, the next step is that we need to read all and to come up all the commitment that have been announced by all the Minister of Health, and all the nurses are committed to go back and understand what is going to be their role in terms of minimizing and being on the table of policy making, being on the table to decide and to take action in order to leave the environment safe, to reduce the cost. Well, a lot of actions that can be taken by the frontline healthcare workers, specifically with the nurses and midwife, because they really compose of 50% of the workforce. So therefore, they have a great impact on being there. So it's not only that a forum that happened within that 1 week, but we need to build on those actions that have been verbalized by all the ministers of health. We need to move and to strongly collaborate in order to work and put actions in terms of reducing the air pollution and lowering health costs, as I said.
So really clear actions to follow up on the messages, both the messages that you've delivered, but also the commitments that the health ministers from around the world have given. Dr. Soumaya, thank you so much for all of your work, for representing nursing, for representing health at COP28. And we look forward to continuing to work with you and the nurses of the region to make sure that the commitments that have been made are now delivered on.
Thank you very much, Mr. Howard. It is always a pleasure to talk and support, because we are part of ICN, consider ourselves. So we need to work together in order to have a brighter future with a great or less impact on our health.
Thanks for your time, Dr. Soumaya. We'll talk again soon. Bye-bye.
Thank you very much. Bye.